Welcome to the Medovia Menopause Podcast, your trusted source for information about menopause and midlife. Join us each episode as we have great conversations with great people. Tune in and enjoy the show. Hi, everyone. Did you know Medovia has the first and only menopause-friendly accreditation program in the U.S.? Our program is the benchmark of excellence, backed by 5 years of experience working with hundreds of employers around the globe with our worldwide partners. You can join now with a 20% discount off your first year's membership in honor of perimenopause and World Menopause Months. Join before October 31st to receive your discount by visiting menopausefriendlyus.com.
Hey, welcome back, everybody. We have our favorite doctor, Kelly Casperson, on board today. She's a board-certified urologist, author, speaker, and the host of the top-ranking podcast, You Are Not Broken. And before we hit record today, we were talking about all the great things she's doing with that podcast. But you probably know her through her best-selling and award-winning book, right? You Are Not Broken.
I'm now an award-winning author.
I know.
Of course you are.
It's a good week.
It is a good week.
Stop shooting over yourself. And her courses and her podcast, Dr. Casperson equips women with practical tools and evidence-based education to reclaim pleasure and confidence at every stage of life. She also makes you laugh. And welcome back to the podcast.
Yeah. Thanks for having me. I was on like 2 years ago, maybe.
Yeah. When you were one of our first guests, we felt like we were all important.
Look at you still podcasting.
I know, right?
Right? It's fun. Going. It's one of our favorite things to do.
Yeah. Really, it is.
Podcasting's the most fun.
Okay, before we start talking about this new book, which I am mesmerized by, I want to swing back to your award-winning book, You Are Not Broken. I was at dinner with a few girlfriends couple nights ago, and your name came up. I don't know why it came up. I mean, because everybody's a fan. But they said something like, Kelly says that you can have 5 orgasms in a row. And we were all like, what?
I never said that.
No, but what? But what I went back to Instagram, and it was a title that someone suggested.
Someone said you should call your book How to Have 5 Orgasms in a Row. But I don't tell people how to have 5 orgasms in the book. It's just the knowledge you gain from that book could cause 5 orgasms in a row.
We were like, oh, I don't know.
We're like, what?
Yeah.
Isn't that funny? I was like, I had to do a reel on that because I'm like, that's a pretty good recommendation.
Yeah. Well, it was. Yeah.
And it was clearly a topic of conversation.
At
right?
the dinner.
They got people talking.
Yeah.
Yeah. So, yeah. Okay. Anyway, I just thought that was such a funny story because I was like, oh my gosh. Okay. I'm talking to her this week and I have to bring this up because
You're like, I don't remember the instruction manual.
No.
Yeah.
I'm like, I didn't put it.
We missed that part.
Yeah. I didn't specifically put that in there.
Okay. Well, you've been super busy. I don't even know how you keep up with your own life. You were on the FDA panel and you're talking about vaginal estrogen. You have a new clinic. You were hot on testosterone. And now you have this new book. I mean, testifying on an FDA panel is a huge deal. And then all these things are happening too at the same time. Why did you feel that the menopause moment was a book that needed to be written right now?
Oh, because there's 80 million women over the age of 40 in the United States alone. And everybody, first of all, nobody knows what menopause is. And the definition of menopause is the natural cessation of periods, which is actually meaningless, right? So like what's actually happening is we're outliving our ovaries.
Yeah.
And that nobody knows that, right? It'd be a lot easier if there were like testicles and we could just watch them shrivel up. But so, the publishers reached out with You Are Not Broken came out and they're like, will you write another book about sex? And I said, yeah, sure. But I would really like to write a book about menopause. And they said, great, write that. And that's why I tell people like my life's not normal because I just told the publisher what I wanted to write a book about. And they're like, yeah. So I'm eternally grateful that I don't know anything else about like book publishing. I'm just like, how about a menopause book? They're like, yeah. And I'm like, great, let's do that. Because I think, and my book's really it's very interesting because when I started writing this book 2+ years ago, I was like, I'm going to come out with the gloves on and basically say, listen, hormones are great for you. You need to know that. And I really wanted to have a book that supported women in their decision. Because even women who are on hormones, they get this backlash from like friends or doctors or whatever. And I really just wanted to have the backs of the women who choose hormones and come out a little bit more strong than some books that are like, ask your doctor if it's right for you. Like, I needed to be stronger than that. So I'm like, listen, I'm going to give you all the data on what hormones do and it gets you to understand that these are molecules in our bodies that make our cells and our mitochondria function. Like, you have to understand what a hormone is and what happens when you choose to live without hormones. And so I was like, oh, that might be kind of an aggressive stance at the time, 2.5 years ago. And that's how fast this is all moving. Because now, like, I mean, you've read it. Like, I don't think it's actually coming across that, not that it was aggressive, but like, it's time for women to know the truth. And I say this in my book and I say it on the podcast all the time. I'm like, I'm not here to tell you what to do. I don't care. I don't have your body. I don't have your life goals. Like, I don't care what you do, but I care greatly that you have the knowledge and the education and the tools to advocate and communicate.
Yeah,
Absolutely.
you're clearly about choice, but be informed so that you can make healthy choices for your overall well-being, right? So we have to educate ourselves so that we can make healthy choices. Otherwise, what are the choices, right?
Yeah.
We're not empowering. Yeah.
And I think what's much more common is women thinking they can't be on hormones when actually the truth is that they can. And for people to understand, like, everything has risks, right? Medications have risks. Like, not being on hormones has risks. Like, just understand that instead of thinking that this is like an easy black and white yes or no. You know, the other big myth is age is a cutoff. Right. So there's just so many myths out there. And I really think my book is like the 2.0 to like, ask your doctor if it's right for you. It's like, no, you get to, we're not all doctors, but we can understand basic physiology, right? We understand dental care. We understand periods, right? We can understand basic physiology.
You do a great job of how to talk to your doctor in this book.
Thank you.
Yeah, because we talk all the time in the workplace about how to talk to your doctor. I'm going to be reading that section over and over again. It's a really good one. But you are unapologetically pro hormone.
Yeah, I mean, I'm pro functioning bodies.
Yeah.
Right. You're like, and I still stutter on that because haters will take it and they'll be like, you just want everybody to be on testosterone. And I'm like, no, I have never said I want side note, possibly vaginal estrogen we're probably at the point of preventative health for everybody with vaginal estrogen. But as far as hormones go, like, I'm pro you understanding if this is a good decision for you or not. And I think the other thing, the layer under that is like this paternalistic, like, only if you're suffering enough, which is a completely non-objective, subjective marker of like if you're worthy of hormones or not. And it's like, hormones don't care if you're worthy or not, or if you've suffered enough. Hormones make your cells and mitochondria function.
Yeah.
They're non-judgmental. It's the humans who are judging.
Yes.
Yeah, absolutely. But it seems like every time we have a conversation about hormones, we come back to the fallout of the WHI study in 2002. But I do want to come back to that for just a moment because
I think you have to.
Yeah, I think we have to too.
Part of the cultural narrative
it's still here.
At this point. Yeah, and
it's still here.
Like, yeah, and I think like why women are afraid of the zeitgeist or the ether, even if women can't say I'm afraid because of the WHI. Like, they can't say where it comes from. And so I think the education goes a long way of like, this is why you're afraid. Because there was some big shit went down in 2002 before social media, before doctors could communicate on a grand scale, when the big legacy media had all the power to influence movement in this country, right? There was some big wind that blew that year. And it was basically saying that hormones caused breast cancer. Which, I mean, the other fascinating thing about the WHI is, that paper is free online right now.
It wasn't before.
It wasn't?
Now? It always has been.
Oh,
okay.
22 years, it's always been free online.
But your point being is that we don't understand it, yet it's free and it's accessible for everyone. So go read it.
You can go read it. And it says breast cancer does not reach statistical significance.
No.
And in the
I think
in the
we're still
medical
living it
world,
though. We're still living around this fear and the outdated perception that it causes cancer.
yeah.
Right.
And how do you get rid of fear? You can't tell people not to be afraid. That's
Right.
not how it works. That's not how brains work. The only way to get rid of fear is to say, here's all the knowledge.
Hmm.
Read it if you want.
Right.
Right. But telling people, like, it's like cognitive dissonance.
Hmm.
We see it in politics all the time right now, of like, if you tell somebody, no, that's not right, they will double down.
Right.
And then they'll tell you about their cousin who was on hormones and had breast cancer, which correlation doesn't equal causation, right? But brains don't know that. So how do you get rid of fear? Education.
Hmm.
I don't know a better way.
Yeah. Which is what you're doing in so many ways, and we're so appreciative. But you talk about the timing hypothesis. And I want to break that down a little bit. I want you to break that down a little bit for listeners and talk about why you think baby boomers should be pissed.
Yeah. So the timing hypothesis is the theory, and it was first developed in monkeys and then extrapolated to humans and done some research. And the theory is that our bodies age and things happen with aging. And if you start hormones before your body starts to significantly age, hormones do a better job at preventing disease. Hormones don't do a good job at treating disease. So the timing hypothesis is at age 50, when your hormones go away, you start aging at a rate that you didn't age before hormones. There's plenty of data on that. 50 is this huge physiologic age point, roughly 50, but different for everybody. And so by age 60, there's been some physiologic changes because you've lived longer than your hormone production that you can't reverse just by starting hormones again, right? So the timing hypothesis basically says that the best time to prevent heart disease, prevent dementia is early menopause. Now we're pushing it. We're saying probably perimenopause, because remember, nothing magical about your last period. Zero magic about the last period. The hormone changes really do start perimenopause. So that's your best bet. And, I tell people, like, on that horrible Tuesday, when you or your loved one is 73 years old and they get diagnosed with dementia, on that really, really bad day, that dementia started 20 years ago. Right? And when is that? That's the average age of menopause for women. And so tying back to why are the boomers pissed? The boomers should be pissed because they were told they can't have hormones.
Yeah.
And now they're being told it's too late for hormones, which is a very interesting discussion. I just did a lecture on it last week that filled up my Zoom to its limit, because the boomers are pissed. And the boomers aren't doing okay in oh, don't worry, the hot flashes end.
Yeah.
These people they have mood issues. They have sleep issues. They have joint aches and pains. They have untreated menopause symptoms.
Yeah.
And they're completely voiceless. They're completely blown off. They're asked if they're suffering enough. And by and large, they're doing everything right. They're eating healthy. They're exercising. They're trying to manage their stress. They're staying a healthy weight. They're lifting weights, right? They're doing everything they can, and they continue to suffer. And they likely will not get the preventative benefits of if you started when you were 50. But if they choose hormones, they will get the hormone benefits of bone protection, less joint aches and pains, better sleep, less hot flashes. A lot of these women, they're still having hot flashes.
Yeah. Yeah. We hear that.
It's this grand paradox. And there is, people say, oh, my doctor says it's too late. And I'm like, there's no guideline that says it's too late. North Menopause Society Guidelines 2022 says best benefit is early.
Right.
They do not say, and then as you get older and you get more comorbidities, it's a risk-benefit discussion. So to behave as if it's black and white is hurting a lot of women. I'd say about a third of my clinic is women in their 70s.
Oh, so I was going to say, so my 77-year-old mother, if I was at her house a couple of weeks ago, and she woke up in the middle of the night with night sweats and had to change everything.
See,
she would benefit.
They're suffering.
Yeah, she's suffering big time.
For years and years and years, by the way.
Yeah.
She didn't just wake up in her 70s having hot flashes.
The boomers that aren't pissed are the ones who don't they've never heard that this is an option. Right? Like once they get educated, they're like, what about me?
Yeah. Well, and so speaking of my mom, who's a grandmother, I read over and over the section on your point of view around the grandmother hypothesis, because yours was the first one that was like,
How'd I do?
well, no, you did great. And I totally understood it. But it was different than anything. Your point of view is different than anything I've ever read on the grandmother hypothesis. Can you talk about that and how to debunk that myth?
And what is it for the listeners that don't know what that is? And then what's your point?
So the grandmother hypothesis is this, it's been used as a patronizing way of saying we were meant to go through menopause because we needed to stop having babies so we could have more resources devoted towards our children's children. So it's basically a justification, which is, so I basically debunk it and say F the grandmother hypothesis, because average age of menstruation, let's say 15, just because it's unpleasant to think about a 12-year-old getting pregnant. But you can get pregnant. I would say average age of marriage in Abraham Lincoln's time was 17. Okay.
Wow,
so you're having a kid in your teens in the natural world. All right. That means you're a grandma by 40.
Right.
Okay.
Right.
All right. You could be a great grandma maybe by 48, if the math's right. Right. And then average life expectancy, excluding infant mortality, maybe 60.
Right.
But if you're a grandma at 30 because you had a kid when you were 15 and then that kid had a kid at 15, which is completely plausible and it's how our bodies work, there's nothing about, oh, thank God my period stopped so I could be a grandma. Right? So what the patronizing grandmother hypothesis did, it says in modern times, we don't tend to have babies until we're 30.
Right.
But that's not how nature works. That's called birth control and like controlled family planning. Right?
Exactly.
Like not our bodies. So to say, oh, menopause is natural, because people will take it and they'll be like, menopause is natural. Therefore you shouldn't treat it because you're supposed to be a grandma and you're not supposed to have kids so you can take care of it. Like that's how kind of dark the grandmother hypothesis has gotten. And even so I put in the book that even the guy who like kind of coined the grandmother hypothesis was like, I'm not so sure about this. And the other big thing is like, what I wanted to name this book Aging in Captivity, because I think my audience gets that. My publishers did not get that, but I got it because I'm like, if you take any animal, except for orca whales who do really, really shitty in captivity because we keep them in small pools. And it's But if you take any animal and you give them clean food and water, you eliminate natural predators, you give them great health care, they live longer in captivity than in nature. Right. There's a harbor seal in Oregon that's like 49 years old right now. And in nature, they live to be 18. Right. And so like we are aging in captivity. We've got clean water. Antibiotics alone has increased life expectancy by 16 years on average per person. Like it's insane. Right. We're really good at trauma. We're really good at treating cancer. We're really good at keeping us alive.
Yeah.
Our average life expectancy now is 40 years with no hormones. And that has consequences. I would also like to argue that erectile dysfunction and enlarged prostate are natural occurrences. And nobody goes around telling men that that's natural and we shouldn't treat it.
Very
so
true.
Really, the book is just challenging the dogma that I truly believe is built to keep women quiet in their place and resulting exhausted, dropping out of their workforce.
Yeah, 100%. Right. And by the way, we often say that we need to change language, that menopause is a natural process, right? It's not natural for someone that is experiencing menopause that's going through surgical or medical menopause. It feels anything but natural. So it's a normal process, but it's not a natural process for everyone. So just want to throw that in there for our listeners.
And we know, to speak to like not that we want to compete on who's having their menopause managed most poorly, but the award probably goes to the early menopause women because we have very clear data. Very clear data of increased risk of dementia, increased risk of death by heart disease if your hormones end before the, for lack of a better word, natural age of menopause of 50. Like that's standard data. And we know that Louise Newsom did this study in the UK, and we don't think it's better in America, that surgical oophorectomy is treated with hormones 5% of the time.
I can't believe that. 5% of
Disgrace.
time.
It's a
It is a
disgrace. I'm a urologist. I will remove testicles for tumors and other reasons. It is a never event to remove testicles and not replace with testosterone. Never event.
Unbelievable. Unbelievable.
If a
Well,
urologist did that, they would be reported to the medical board and probably
for
would lose their
sure.
license.
Oh,
For
yeah.
sure.
That ticks me off.
It should.
Okay, I want to talk a little bit more about things that frustrate us, because why not? While we're on that subject, myths, misconceptions that still frustrate you.
You can't be on systemic hormones and vaginal hormones at the same time.
Mm-hmm.
That hormone replacement therapy only means estrogen. That you have to stop hormones at a certain age because I said so, because now you're too old. You can't start hormones at a certain age because I said so, or you're too old. What else? That painful sex is normal. That it's really awkward to talk about sex, so we shouldn't talk about sex. That your doctor knows best about hormones.
Just a few.
That's a
just
couple.
few. Yeah.
Okay, let's talk about sex because
Let's talk.
you're the best one to talk about this with of anybody.
I'll
Mainly
take that as a compliment. Thank
Well,
you.
at any
Sure.
age too, by the way, because our daughters love your last book, and
Oh.
they do. And
They
and
do.
you know what? They're giving your book to their friends, and they're in
No
their
way.
20s. Yeah. Yes, way. I think it's fabulous, and that conversation is happening at a younger age. So bravo. Yeah. Thanks
Thank
for
you.
breaking it down in such.
Go young women.
Go young. Yeah. Kim, go.
The senile vagina. What is it?
Senile vagina is a medical term in the 1980s to describe what we now call genital urinary syndrome of menopause. So thinning of the tissues, decreased lubrication, dryness, tearing, pain with penetration.
And so do we get it? How do we not get it? Like how do we keep it?
Well, hopefully
we all
nobody
get
gets, yeah, hopefully nobody gets senile vagina anymore because it's an antiquated term and we try not to use it, but I use it in my talks a lot because it makes people laugh and it makes them mad also. Mad laughter. That's really what I'm going for.
Yeah.
50 to 90% of women post-menopause. And again, the problem is women don't know what's actually going on. You've outlived your ovaries. Ovaries make hormones that make your body function well, right? Like that's what they don't understand. Or I'll be like, this is because of menopause. And they're like, my last period was 8 years ago. You're like, oh, you thought this was just the end of periods. Periods is just a symptom of what happens because of low hormones. Right. So, even the whole conversation about menopause and a lot of thought leaders now are like, we need to stop actually talking about menopause because it's not clear of what's actually happening. But there's no female word for castration, which is very interesting because words matter. But so, GSM can happen years after your last period. It can happen in perimenopause. It can happen with breastfeeding. It can happen with cancer treatment. Like there's lots of things will affect the tissues. The gold standard is hormone therapy because that's why it's happening. Right. And this is local vaginal hormone therapy, most commonly an estradiol product. The DHEA product is also lovely, but it's expensive in America. And it works wonderful. And people use moisturizers and lubricants for comfort. Nothing wrong with that. They help hold in moisture, but it doesn't solve the underlying pathophysiology of why it's happening in the first place.
Well, and you mentioned earlier that we're getting closer to vaginal estrogen being preventative medicine as well. Because I think typically what happens, correct me if I'm wrong, but we end up in the doctor's office because our vaginas are so dry, because the sex is so painful that we
want you to suffer first.
Yeah, we've reached a point where we're like, I am freaking miserable. And what is happening to my body, right? I don't understand because nobody told me that this was coming. Horrible place to be. So can you speak to that a little bit? And maybe even sprinkle in there your conversation on the FDA panel. What's happening with that black box warning, and talk a little bit more.
Because of the WHI, which we now know nearly everything's been walked back on the risks of that, the FDA put on what we call a boxed warning on all estrogen products. What I mean is synthetic estrogen oral estrogen, synthetic oral estrogen, transdermal estrogen, vaginal estrogen, anything remotely that wasn't even studied in the WHO. They just went, that would be like putting a label on a statin and then applying it to a blood pressure medication and being like, well, they're both on the heart. So we should call it all the same. Like synthetic estrogen that you swallow is very different than a vaginal bioidentical estrogen product. I don't expect everybody to know that, but I'm trying to explain the madness of putting a warning label on things that are not the same thing.
Right.
So the warning label says stroke, heart attack, liver disease, probable dementia, which is a stronger term than possible dementia, on a vaginal estradiol product, which is just skincare. It's just skincare. If I measured your blood after you going on a vaginal estrogen product, it would still be postmenopausal. It's not getting into your bloodstream. And the reason why, because people don't know this, they're like, why doesn't it get into your bloodstream? Dosing. Dosing. So it's a skincare product, skincare for down there, which is already trademarked, not by me. Sadly.
Oh, shoot. Because I attribute it to you all the time.
No, I just say it, but it's not just, I can't sell it. So
you can say it, but can't sell it.
Okay. I can say it, but I can't sell it. Twice a week is the maintenance dose. And here's the proof of it's preventative medicine. So a woman comes in with recurrent UTIs or bad bladder urgency frequency, getting up at night. We put her on a vaginal estrogen product and it gets better. Do we tell her to stop it? No. Tell her to stay on it. So we're already using vaginal estrogen products for preventative health. But I don't want you to get another UTI. I don't want you to get up 5 times a night to pee. I don't want you to start having pain with sex again. Right. So we're already using that product as preventative health. And I think the needle is, the biggest thing for the lay population is when they're like, you mean my labia minora goes away and my clitoris shrinks with hormone changes? Or like, yes, they became adult via hormones and now you're outliving your hormones, so they go away. And so they want to go on the products just to preserve function. And there's nothing wrong with that. Now that's from a doctor's point of view, we're like, that's not the worst thing that can happen. But from their point of view, it is the worst thing that can happen.
Yeah, it's shocking, right?
Yeah. So to me, I'm like, there's a little disconnect in like, we think this is the biggest problem. The doctors are like, but you're not having recurrent UTIs. It's not indicated. So I think it's worth it. Like if penises shrank, what would we do? They'd want to do something about that. Yeah. So I think it's very fair. In America, it's still a prescription product, but we are getting closer. Universal agreement that this warning shouldn't be on vaginal estrogen products. Universal agreement by the experts. There's studies on over 55,000 women, including breast cancer survivors, including people on aromatase inhibitors. So it's near universal that vaginal estrogen is safe. Then begs the question, why isn't it over the counter?
Right, exactly.
Right? It is limiting access that you actually have to see a doctor and hope your doctor's trained to give you.
Well, and I think that's a key point there. I'll share the story. My mom is in her 70s. She had recurring UTIs for years and years and years, antibiotic resistant. Like it was getting scary, right? I asked her the question not too long ago, "Hey mom, are you on vaginal estrogen?" She said, and she doesn't mind if I share this. She said, "I don't need that." I didn't ask what that meant, but I don't need that. And I said, yes, you do. Talk to your doctor, and here's what you need to ask for. And she talked to her doctor, and doctor was like, oh, are you sure? And she said, yeah. I said, be adamant. Tell her you want it. Write the prescription. Don't take no for an answer. She did. She hasn't had another UTI. I mean, come on, right? But this is what we're facing, right? We need more education. Yeah. We need education for healthcare practitioners. We need more education for the general public so that they understand what's happening, so that they make those healthy choices that we talked about in the beginning of the podcast. Absolutely. Yeah. But just to recap, we can take vaginal estrogen combined with our transdermal estrogen or systemic estrogen. We can start vaginal estrogen even in perimenopause. Yes.
Yep.
Yes. And you can, with your vaginal estrogen, okay, I'm going to get a little bit more in detail here for listeners, but it comes in a tablet, it comes in a cream, it various forms. But you also want to apply the cream on the outside as well as the inside to keep it healthy.
if you care about your genitals, yes.
Yeah. Okay. Yeah. Yeah.
I mean that's some people like the tabs because it's less messy,
Right.
right? But the tabs are actually pretty low dose and they're contained in the vagina. So it can be, great for a non-sexually active person who has recurrent UTIs and you just need a little bit of estrogen in there. But if you're sexually active, especially if you started noticing decrease in sensation, tightness, pain, decreased lubrication, all of those things, it's not in your head. Those are hormone issues. I like the cream. It's like people are like, oh, it's a little messy. And I'm like, do you remember your 18-year-old vagina? That is messy.
Want it back? Yeah.
That is lubrication.
Yeah,
right?
absolutely.
And so I joke around about it with a little bit, but I truly, if you put it like index finger, fingertip to first knuckle, that amount in the vagina, and then fingertip to first knuckle or in the external genitalia, and rub it in. Like I always say, it's like you're in Texas in August with sunscreen
With
and you don't want to
sunscreen.
get burned. Like rub it in.
That's
Get it
great.
in the tissue. Don't just like slap it on and put on your underwear and have it go on your underwear.
Yeah, and then
Like,
it's on your underwear.
Not gonna help.
Right.
Yeah.
Right.
And then here's the next question, which is telling but sweet. Is people are like, what if it gets on my partner's penis? And I'm like, they have estrogen in
Yeah.
their body. Number one. Number two, it's skincare, right? Like it's not going to hurt them. Don't use estrogen cream as a sexual lubricant. That's not what it's designed to do. But if you happen to put on your vaginal estrogen that night and the mood strikes, it's not a reason to say no. You're not going to hurt anybody. They've actually done a study on this.
That's good. Yeah, that's actually a good point. Kelly, we have about 5 minutes left on our podcast, and I have so many questions for you, but I really want to come back to your book. And there's so much information contained in that book. I hope everybody goes and purchases that book. But what haven't we talked about that's in your book that is close to your heart that you want our listeners to know?
Oh, I really don't think everybody knows how bad alcohol is for your brain.
Oh yeah, I was going to bring that up.
And how beneficial exercise and lifting weights is for dementia prevention and breast cancer prevention.
Yeah.
Right. And I think we lose those when we talk about hormones, because hormones are hot and everybody kind of wants them to be the holy grail. But it's like I can't slap on an estrogen patch and expect it to do much if you're drinking and you're not sleeping and you're not exercising and your mood about getting older is shitty.
Mm-hmm.
Right. So I talk about mindset and really
Mindset.
that, so many people are like, growing older, bah. And I'm like, my grandma said there's only one alternative and she's right. She made it to 96. And there's actually data on your mindset about growing older actually affects your health. Yeah. So I have a chapter in there on mindset because estrogen patch won't do that all for you. And there's so much we can do that isn't hormones. Because again, all hormones are messengers that help our cells function. That's all they are, right? We still have to do all these other amazing things that feel good and help us thrive and not just age, but age with health.
Mm-hmm. I really appreciated that balanced approach because you are pro-hormone, but you emphasize lifestyle and mindset and have that balanced approach in the book. And it's extremely important. Kim and I both believe in that. We're health coaches, we're yoga instructors. I mean, it's the full meal deal, as we call it. It's not just one solution. All right, Kelly, we're going to ask you this question again. And because I can't remember what your answer was the first time that you were on the podcast, and it's probably different now. But we ask everyone the same question at the end of our podcast, what the best piece of advice you've ever received or given has been. So what would your answer be today?
I think this might be the same answer.
Okay.
I was a medical student doing my general surgery rotation. Like I remember where I was standing. I remember that I was halfway up a flight of stairs, turning around, looking down. Like it was profound statement. And it was a general surgery chief resident. And he said, nobody is more in charge of your education than you. Mm-hmm. And I think that ties into like why I'm writing these books and why I want women to have the knowledge, because nobody is more in charge of your body and your knowledge about it than you.
Such a good reminder.
That's huge. And your book does such a good job of informing you about your body. I mean, like, for example, you talk about men having estrogen. I didn't know that for
Mhm.
years. I mean, I didn't know that till I started getting into the menopause business, that this was, there's so many things like that you just need to know. And this book does such a good job of describing all the things that are happening to your body and what your options are. And I can't tell you enough. It has, as I said in my LinkedIn post, it has your sense of humor and also great knowledge. And
Thank you.
just really, really appreciate it, because it is different for our listeners. You know, it is different than the other books that
Mhm.
have come out on this topic, because
I think so.
It's so informative.
Yeah,
Mhm.
I think it's really approachable and friendly, and I really want to narrow the gap between medical knowledge and you.
Mhm.
Like I want to narrow the gap between like this unobtainable stuff. Is like no, we can all understand this, and it's a true compliment, because I'm like, I was worried. You Are Not Broken is so loved, right? And it's so me and
It's
my
award-winning.
personality. It's award winning.
I mean,
What can I say at this point? But really worrying that, like, did the science overwhelm the personality to the detriment of the menopause moment? And so far, I'm hearing that it hasn't. And
no, I mean,
it's
you
blending.
F-bomb throughout the book. You like, are you kidding me?
You're real. You're a
Bold
person. You're a human
things,
being.
like,
Thank you, Kelly.
I
I texted a friend. I was like, pages before the F word comes out in this book, like 63 or something like that. It's like,
It's okay.
No, it's
Kelly,
totally.
where can our listeners get your book? Where can they get it?
wherever they want. So it's on
Okay,
Amazon,
everywhere.
Barnes and Noble. If people want to do mom and pop local bookstores, great. I know a lot of them are carrying them. And on my website under books, I actually have a whole list for mom and pop if they want to do a retailer that isn't that local chain started in Seattle.
Fantastic.
Called Amazon.
And you're traveling, I mean, the world essentially. So people could look up on your website.
Yeah,
where
I just got an event long overdue. Just got an events page on the website, because now I think we're up to 8 cities. We just
Great.
like added Connecticut yesterday.
Love it. Love it.
So it's hard to keep track of.
And
But
if
I
you
will see you
haven't
guys in
seen-
Seattle and Bellingham.
Yeah, we'll see you on
Yeah,
the 29th of October. So
Yeah, for
if you're
people
in the
who wanna
Seattle
know,
area, come
29th
join us.
of October
come
in
see our
Seattle.
friend.
Yeah. Yep. And if you'd like to see Dr. Kelly, you have your own clinic as well up in Bellingham, Washington. So you can look her up on the website there as well. But
I see my poor math. Like, these are percentages, but it's about a third perimenopause, a third boomers who are pissed, 70 plus, and then a third regular menopause people, and then probably about 5% men.
love it.
I love seeing partners. So we have a good time. We get lunch. We take care of everybody. It's really fun.
Oh,
I love
man.
that. Great reminder too that you see men as well and couples. So
Yeah.
Kelly, it's been a joy. It's been a pleasure. We could talk all day long, but we thank you for your time. And listeners, until we meet again, go find joy in the journey.
Thanks,
Bye,
Kelly.
everyone. Thank you for listening to the Medovia Menopause Podcast. If you enjoyed today's show, please give it a thumbs up, subscribe for future episodes, leave a review, and share this episode with a friend. There are more than 50 million women in the U.S. who are navigating the menopause transition. The situation is compounded by the presence of stigma, shame, and secrecy surrounding menopause, posing significant challenges and disruptions in women's personal and professional spheres. Medovia is out to change the narrative. Learn more at medovia.com. That's MIDOVIA.com.